Welcome, everyone, to the CO podcast series, Stroke Matters. A special thank you to Advocate Aurora Health for sponsoring this podcast. My name is Christine Winicky, CO Director. The topic for today's call is music therapy. I would like to introduce our presenter for today. Deborah Sasko has been a board-certified music therapist and on the executive board of the Illinois Association for Music Therapy for 9 years and is serving her second term as president of the association. She has worked with a wide variety of populations throughout her career, including children and adults with developmental disabilities, children on the autism spectrum, adults with mental illness, adults with Alzheimer's disease, teens and adults in physical rehabilitation facilities, and adults with traumatic brain injuries. She gained additional certification as a neurological music therapist in 2011. Deborah has supervised music therapy interns as they work towards their certification and has mentored recreational therapy, drama therapy, and art therapy interns. She has presented at regional and national music therapy conferences and continues to coordinate continuing education courses in Illinois for music therapists as well as social workers and art therapists. Welcome, Deborah. What a resume. That's awesome. You have so much experience. We're so excited to have you today. Thank you.
I'm so glad. I just love talking about music therapy.
Oh, you know what? And this is just such a great topic. So that's how I just want to get started. I just want to ask you, what is music therapy?
So the nice technical term is music therapy is the clinical and evidence-based use of music interventions by a board-certified music therapist to accomplish non-musical goals. So its goal is not to teach a skill like the guitar, piano, or singing. That might be an ancillary goal within someone's treatment plan, but the goal is to use music as a medium through which the music therapist can address physical goals, psychological goals, cognitive, social functioning goals.
Awesome. So what exactly does a music therapist do?
So depending on what population we're working with, the thing that we always start with is an assessment. So just like any of the other allied health professionals like occupational therapy or physical therapy, the first thing that we do is we get diagnosing information from someone's family health doctor, their surgeon, their nurse, and we get information about what goals we're working on, what they want to work on in the short term and the long term. And then we also get to talk to the patient and we get to talk to their families or their friends and ask, what kind of music do they like? Do they like to go to concerts? Do they play an instrument? Do they like to dance? And after gathering all of that information, we get to design a treatment plan to help meet that person's individualized goals. And we use music that they prefer in that treatment plan. So if I'm working with a client that has Alzheimer's, and one of their goals is to increase socialization, to decrease maybe mood outbursts that they might be having, increase even appetite because they might not want to eat as much, which can be very much related to their mood, then I'm not going to go in and start singing Britney Spears with them. I'm going to ask them, what music did they listen to in their teens and their 20s? Because that typically is the music that stays with us through our lives as our favorite styles. We kind of grow and add on to it as we age, but we tend to stick to those as kind of our favorites. They're also the songs that are most embedded in our brain's memory. So whatever goal I'm working on, I can capitalize on the songs, the melodies, maybe even the dance moves of the music that that client listened to, and use that music to help that client achieve their goal.
Oh, that's awesome. And I agree with you. I mean, I still stick to the music that I listened to back in the 80s. So I can appreciate that. Do you have and are you actually in the hospital, or how does someone connect with a music therapist? I mean, is that like, are you in the hospital, or do they come to you after they've been discharged, or how does that process work?
It depends on the facility and the music therapist. So some of us work full-time in, say, a rehab hospital. Say downtown Chicago has the Shirley Ryan Ability Lab that I believe was formerly called the Rehab Institute of Illinois. Some of us work in an Alzheimer's care facility or in an inpatient psych unit. And so we go into that facility every day and work with the same general group of people and staff. And that facility usually has their own system by which they refer therapists to their clients. So they might say, okay, well, this person just came out of a knee replacement surgery, and they have been saying they really miss listening to their iPod. We could get an iPod in here for them to listen to, but they need to work on their physical and motor goals too. A music therapist is going to be able to do that and also increase their self-esteem and their mood and be able to really help them work towards that goal. So that music therapist will then go to that person's hospital room or to the rehabilitation center and work one-on-one with that client. There might be a situation where someone already does receive services at a hospital or at a group home, but they want more, in which case they can contact a music therapist through a series of databases. In the Illinois Association for Music Therapy, our website is musictherapyillinois.org, and we have a little tab that says Find a Therapist. And if someone say coming out of surgery, or they know that they're going to be needing possibly some physical rehabilitation or speech rehabilitation in the future, and they want to supplement that with music therapy, they can find their own music therapist. And we've got our own independent businesses, and we even sometimes contract with other rehabilitation centers, sometimes on a client-by-client basis. So they can get in contact with the doctors or the rehabilitation specialists or the nurses at their facility, or they can go online and find their own music therapist themselves too.
Okay, that's awesome. You kind of, my next question was going to talk about the benefits of music therapy, but I was thinking, can you describe, maybe, is there a patient that, that stands out to you that really benefited, that really made, that turnaround from, working with you or working, on music therapy?
Oh, yes. So many, but the one that immediately stands out was when I was working with a stroke survivor specifically, and I was using a specific music technique called melodic intonation therapy. And it's a neurologic music therapy technique where you use a known song in order to prompt speech in someone that has experienced what we call Broca's aphasia or expressive aphasia. So they have a hard time kind of creating sentences and getting them out on their own. So what a music therapist can do is I utilize music that he knows and loves. He loved rock and roll from the 70s. So there were some Queen, some Rolling Stones in there. And I came every week and helped him work toward using lyrics that were already in a song and reteaching him how to actually speak those words, because he had the memory of them in his brain, but his body needed to remember how to move his mouth and his throat and use the air to actually get those words out. So for a little while, we were working on short sentences, like singing the song, I wanna hold your hand. And he would be able to sing, I wanna. And then the goal that we had long term was for him to then insert what he wanted at the end of that phrase. Giving his brain that prompt, that kind of hint about what he wanted to say, helped him to then be able to add in his own request at the end of that sentence. So after many weeks and months, he was able to say, I wanna water. So he was able to ask for water in a way that was much more easier than him just sitting without any melody or rhythm to prompt him. Trying to muscle out water was really challenging. But getting that musical prompt in his brain, he was able to sing to his nurse that was there every day when I was there. He was able to sing, I wanna water, or I wanna movie. And that was the baby step that we were taking in order to help get him to fuller functional sentences. After many weeks of working with this gentleman, he was making great progress. I loved especially being able to rock out with 70s music with him. And but spontaneously at the end of one of my sessions, he was working on saying goodbye and see you later without any music at that point. We'd graduated from using the rhythm. And instead of spontaneously saying goodbye, he said, I love you, and sang that to me.
Wow, that is absolutely awesome. I mean, I have witnessed some of how music therapy has helped stroke survivors and people with brain injury, and we've had music therapists at annual conferences, and I just see um, how important it is for the recovery, particularly in dramatic brain injury, and that's what we do. But it really is something very important, and I think really beneficial to the patients. Can you let me, is there any research that sort of supports this? I mean, we obviously see it because you've seen it, I've seen it, we've seen the benefits, but is there any research that does support this?
Yes, quite a bit. And I would really recommend if anyone is interested in the specifics, there's a great publicly available website, PubMed. It's run by nih.gov. You can go to pubmed.gov, and they have so many peer-reviewed research articles from, I want to say, hundreds of different research journals, including the Journal of Music Therapy and Music Therapy Perspectives, which are the two main peer-reviewed research journals that the American Music Therapy Association puts out. So you can go to pubmed.gov and just search music therapy, stroke, and see just thousands and thousands of articles. And it shows such a great wide range too of the research that has been conducted, some things that you might not even think of using music therapy for. So one of the most recent ones I saw was the effects of music therapy during a total knee surgery, and whether it decreased the amount of pain medication that was needed, and whether it decreased the anxiety following the surgery. And it showed that it did lower the anxiety. There's so much research about stroke rehabilitation and what different types of music help in improving expressive communication, and also physical rehabilitation. There's lots of research about music being used in neonatal intensive care units to help newborns regulate their breathing, improve their suck so that they can gain the nutrition that they need, and just almost every population you can imagine, from autism to Alzheimer's to mental health. There's great research articles, and you can just read their abstract that has their goal and their results and their methods, and it's just awesome to see all of the different ways in which music therapy is being used. Because then we as music therapists can take all of that new information and apply that, so we're always applying the best practices to our sessions.
Right. And I, again, I can't speak more highly about music therapy, and I agree,
Thank you.
Especially in this day and age and what's been going on. I mean, music just is that comfort and that relaxation and that, those known songs, and that music just brings you back to a place of a happy place often. Mm-hmm. I think that's just, I agree wholeheartedly.
Yeah.
I have another quick question for you. So do you involve like the patients, their family members? Do they get involved in all of this also? And kind of, are they a part of that whole treatment plan, or?
As long as it's clinically appropriate, if it doesn't impede the music therapist's ability to do their sessions, and especially if the client is comfortable with it, absolutely. I've had mothers in with their spouses. I've had a mother in with her daughter, a husband there with a wife. So as long as they're comfortable with it and they're they can get on board with it, I say. For example, I've had some family members that they didn't want to sing. And so, and I noticed that their spouse, who I was there working with, didn't want to sing when their spouse was in the room. Turned out they were both embarrassed by their voices. So it worked better without his wife being there because he wasn't as embarrassed.
Right.
And I thought, oh my goodness. And after a while, they started to realize that, like, I'm not looking for them to sing like Botticelli. That's not our goal. Our goal is to have fun together and to work on these skills. And oftentimes having a family member there, or their caregiver there, their nurse there, they get to see the strategies that we use in the music therapy session, and then they can generalize that to their home life or to the other tasks they're working on around their home. So I think it's excellent and awesome and super productive and beneficial when a family member or a caregiving member can join the session.
And I think that's why I was asking the question. I was wondering how that can kind of be carried to their home life, because they obviously can't be with you forever.
Mm-hmm.
So, how that just, and that was a great example of how that can just be carried in. And I totally can appreciate the not a good voice and being embarrassed because I'm one of
Yeah.
those people. But that's great. I'm glad that, they are included and there are times when, it's not appropriate. Do you have other resources where people can learn more about music therapy? Are there other maybe websites or places they can go to learn a little bit more about music therapy?
Yeah, I'm going to suggest three main big ones. The first one is just musictherapy.org, and that's the American Music Therapy Association's website. It is packed full of research articles, information about how to become a music therapist, if anyone is interested in that, information on how you can advocate for music therapy to try to get it established in your school or hospital. There's a specific tab that shows that you can find a therapist. So if you're not within Illinois, even if you are in Illinois, you can find a therapist in your area that works with your specific population. So if you're a mother looking for services for your child with autism, you can click that Find a Therapist button and find someone. So that's just got everything you could ever want to know about music therapy. And then more locally, musictherapyillinois.org is the website for the Illinois Association for Music Therapy, of which I'm the president. We have a similar page that's localized to Illinois. So if you're looking to find a music therapist, you can click the Find a Therapist page and you can look for someone either in your area or that serves the population and the need that you have, or both. There are tons of private practices and businesses that are accepting referrals right now and doing teletherapy right now as well, as I know that's a huge need. So if anyone's services have been discontinued due to this current pandemic and crisis, you can seek out teletherapy from a lot of fantastic music therapists in Illinois right now.
Wow, great resources. And that's a great suggestion because we don't want to stop now. We want to continue on the, the progress that patients and people are making. We don't want to stop that process.
Right.
So I think this concludes. Did you want to maybe share a quick song with us before we conclude?
Yeah, I thought I might do a little example of just how we might use a music intervention in a stroke survivor's treatment plan. So I picked a song that I've used many times with this population and typically works with just about anyone over the age of 35. It's a super well-known song. And what music therapists do that's so important is that not only do we ask for the preferences of the client that we're working with, but we also capitalize on songs that are really well known, songs that are just embedded in our memory, like Happy Birthday or certain holiday songs. Gabby Giffords, she's a great example. She received music therapy following her traumatic brain injury, and they use songs like Happy Birthday and You Are My Sunshine to help prompt her speech rehabilitation while she worked with a music therapist in her recovery. So this song that I'm using, I'm going to kind of just pretend you're my client right now.
Okay.
And I'm going to ask you, wherever you're sitting or lying, take your hand if you're able to move it and tap your knee while I start to play the guitar. And if moving your hand is a little challenging, even if you just rock your body back and forth, we're kind of going to give the body both melodic hints about what we're going to sing and rhythmic hints. So you might even be able to guess what song I'm going to sing.
Not yet.
Not yet? Okay. So next, I'm going to start singing. And if you recognize any of the words, I'd like you to either hum along or if you're comfortable, sing along. And if neither, you can talk them.
Okay.
When the night has come and the land is dark and the moon is the only light we'll see. You know it yet?
I do, but I don't know the words.
No, I won't. That's okay. We'll get there. Be afraid. No, I won't be afraid. Just as long as you stand by. What do you think? Can you sing?
Yeah.
So darling, stand by me. Oh, stand by me. Can you speak this next one? Stand by me. Stand by. You got it now?
I think So
Yeah. So do you think you can sing it with me?
I'm trying.
All right. Excellent. All right. We'll do the chorus just one more time and sing whatever words you can. I might drop out and let you solo for a second. Okay.
I hope not.
Darling, darling, stand by me. Oh, stand by. Stand by. Stand by. Stand by. So in singing that song, I would be prompting the client to finish the sentence with me, or even to make the phonation sounds that will be the foundation of relearning to speak. So even if they can only say me, we'll work on that last me sound. The word stand is a blend. That's a tricky word. Sometimes they might only say sand, but the brain has that hint of what it's supposed to say, and that memory is so deep. And being flooded with the hormones of listening to a song that we enjoy, it's more likely that the brain will be less fatigued by doing this practice, and the client will be more likely to repeat this exercise either more times or for longer durations, which will then help to greatly increase the effectiveness of the speech goal.
Yeah, that's awesome. That's awesome. And that was great. Thank you so much for sharing a song. I think that's an excellent way of just kind of ending our call so that people can get an example of how it's used and songs. And you have a great voice, by the way, and mine was so good, but I tried my best. So I just like to thank you, Deborah, for being our presenter. And if you would like to listen to today's podcast or past podcast, you can visit the CO website at www.sseo.org. Thank you. And thank you again, Deborah.
Thank you so much.